My name is Peter Bianco, and I'm the CEO of OsteoApp.ai, technology developed to detect fragility fracture risk assessment enabled by artificial intelligence. Our market and what we're addressing is the urgent public health crisis in osteoporosis. It's a silent disease that affects millions of people, about 10 million people in the United States. And the incidence of this particular condition is greater than breast cancer, heart attack, and stroke combined for elderly women. The problem in the market right now is that 75% of the people who have osteoporosis or at risk for osteoporosis don't know it, and they don't find out that they have osteoporosis until they fall and break a bone. And in the case of hip fractures, which is the most common, 1 of every 4 people that experience a hip fracture due to osteoporosis usually does not survive it. That particular problem is now a major cost burden on the U.S. health system, with a currently $19 billion a year spend in the current health system, going to $25 billion by 2025. This is an unsustainable growth rate in this cost burden. We are taking a clinically validated FDA-cleared product that's been in use in Europe for some time, and combining it with exclusively licensed artificial intelligence technology licensed from the University of Rochester, and further development through the Mayo platform of our artificial intelligence platforms. We have essentially 2 methodologies by which we use this clinically. In-clinic assessment for a patient that comes in for an X-ray for one reason, and our algorithm, as you can see on the right-hand side, what our product does, can scan that hand X-ray and come back with an osteoporosis score within 30 seconds. This has all been clinically validated in Europe, and we're taking that technology from Europe and reapplying it under a new clinical model in the United States. The other aspect of this is that we are able to take our technology and screen and sort through thousands of existing X-rays that currently exist in a hospital or a clinic setting, and come back with a population health risk assessment for fracture due to osteoporosis within hours. So we have 2 essential pathways. Patient comes through.
Sorry to interrupt, but your time is you're out of time.
Okay.
Sorry about that.
Mm-hmm.
So judges, could you please turn your cameras on and mic on? And you have 3 minutes to ask questions.
Okay. Peter, you made a pretty compelling case that there's a problem, but you didn't have time to get to your business model. Can you very quickly describe the business model that you have?
Yeah, so we have a subscription, software as a service subscription model, which is similar to several other companies that are moving ahead of us in this space in tangential markets, where we would charge a hospital system an annual subscription with a click fee based on the number of images.
Hey, Peter, this is Raven. Great presentation. It seems like a really big opportunity, but there seems to be some barriers to access. So can you speak to why some of these screenings currently are not taking place?
Yeah, the current technology is DEXA, dual absorptiometry, X-ray absorbed geometry. It's a large piece of capital equipment, and it requires a specialized technician to run it. Our technology does not require any capital expense or a specialized expertise to run it. Anywhere an X-ray machine exists or X-ray infrastructure exists, our software will work. And it's installed with a small client behind the firewall in a clinic or hospital setting, and it shoots the X-ray out to our cloud servers to do the analysis, and we send a report back in 30 seconds.
Peter, this is Frank Mortari. Does the marrying of the cleared product with the licensed software require a new trial and getting some regulatory clearance?
No, these are class 2 medical devices, yeah. 510K, and we're using the existing technology as the predicate device.
Okay.
Hi, Peter, this is Anna. What actionable items can clinicians or patients take based on these earlier diagnoses?
Well, earlier intervention, and what's happening in the orthopedic space right now is a recognition on the part of orthopedic surgeons that although they don't manage osteoporosis patients specifically, they're in a position to identify and cause a referral for an early intervention. And that's an awareness now that seems to be building in the orthopedic community. So our feeling is that it starts with orthopedic surgeons, yet if they inserting our technology in their care pathway early, they're aware of this patient's condition and can refer them to the appropriate specialist for follow-up.
And can I follow up? Are there some cost advantages over traditional system?
Yeah, so most of the systems that are on the market now are a capital expense. So, and there's ongoing maintenance fees and things like that. This is pure software. So our cost of goods sold are almost zero at this point, besides the development and clinical testing. So it's a very cost-effective model that we can deploy very inexpensively versus the existing technologies.